And now we have a very special interview lined up. Joining me on the line is Dr. Baruch Fischhoff, Professor of Public Policy, Psychology, and Strategy at Carnegie Mellon University. He's also a member of the National Academy of Sciences and National Academy of Medicine. He is on the line to give us some insights into the psychological impact of the COVID-19 outbreak. Good morning, Dr. Fischhoff.
Oh, hi. Thank you for having me.
Thank you so much for joining us. So let me start off by asking you, as a psychologist, what's your greatest concern regarding the COVID-19 pandemic?
The thing I most worry about is people not having good, trusted information so that they can make sound decisions about their health and the health of other people. If people understand what's happening, then they can make sensible decisions. If they don't get good information, then they end up going in different directions. We don't have social coordination, and people lose trust in the authorities who should be giving them that information.
Professor Fischhoff, though, but we are bombarded with news regarding COVID-19. So what is your definition of good, trusted information?
Well, it should be medically sound information presented in a comprehensible way and given and chosen so that it makes difference to people's decisions. There was a short announcement just before we came on from, I think, the Korean CDC, which seemed to me like a good communication. It had a very simple message, the things that everybody could do, and there's actually not that much new information that's coming out. People are looking for information. We would like somehow for this problem to be solved, but there are relatively few things that we need to do that will get us a lot of protection give us the best deal, best bargain in terms of protecting ourselves and others.
Do you think there has been some problems in communicating the, as you mentioned, the medically sound information within a country and also globally as well? I mean, obviously the COVID-19 outbreak is still a new one. We're learning more about it every day. But do you think there's some mixed messages being sent out by governments and people in authority?
I can't judge for the Korean experience, but that's definitely the case in the United States. There was no clear authority from, say, our Centers for Disease Control and Prevention or our Department of Health and Human Services, and about what was known, how well it was known, and when better information would be available. And as a result, that vacuum was filled by all sorts of authorities or amateurs or conspiracy theorists, and it got away from people, because when you come to a new problem, you don't know who to trust.
Right. That
trust is, in a sense, the government, the public health officials, is theirs to lose. And I think here, at least, they lost it.
When there is a lack of medically sound and trusted information, I guess the public can react in two ways. They can either overreact and they could have an overblown fear of the unknown, sort of, or they could be very complacent or sort of blasé and think that they're immune from the disease. What do you think is the greater risk right now?
Well, in this case, it seems to be underreaction, given how severe the consequences of the disease are, either for the individual or the other people that whom they come in contact with. The idea of over and underestimation is relative to some truth which is not available to people. So I would hesitate to criticize people for getting it wrong if the good information hasn't been presented to them. So this is a problem with the communication, not necessarily a problem with the individual.
But it does seem like more and more countries around the world, more and more cities and states in the U.S. again are also putting their citizens under lockdown. So all these measures are being put into place. A lot of information is being put out there, and yet some people are not heeding the public advice for social distancing, even quarantine measures. We are still seeing reports of people going out on the streets, not heeding the advice. What's the psychology behind that?
Well, this country has 330 million people. You can find examples of just about anything. if I go out on the streets of Pittsburgh, they're very quiet. We just had a stay-at-home order from our governor 2 or 3 days ago. There seem to be several reasons why people are not taking this seriously. There are some people who really don't understand it for whatever reason. There's some people who are having one last fling before things quiet down. There are people who perhaps underestimate the risk for themselves because early on there was indications that it was much. As the evidence is accumulated, we've discovered that the effects seem to be more severe for younger people than we thought. I think there are people who don't realize the risks that they pose to other people, that they themselves are a disease vector that could affect vulnerable people. Mm-hmm. And we have, at least in this country, we have people who as a political, ideological statement, are defying these instructions. They belong in a community that follows leaders who tell them to ignore it, and they believe those leaders rather than the medical authorities. So It's an ideological statement.
To continue on what you mentioned before, especially regarding younger people, we've seen reports here in Korea and also in the U.S. I believe lots of university students are on spring break, that young people seem to think that they're immune somewhat to catching the disease, and even if they catch it, that they would be largely asymptomatic, or they wouldn't be largely affected by this. So despite all the public pleas that they could be passing on the disease to their loved ones, whatnot, it still seems that maybe they're not quite getting the message. And as you said, they're having that last maybe party or last chance to socialize. What, in your opinion, could be a more effective way to get the message across to them then? Because I recently saw a message from, I think, some Italian mayors, and they were very frustrated with how people were still defying the quarantine orders. And some mayors even came out and said the army will be patrolling the streets. They will be coming out with flamethrowers even. I hope he was joking, but in an attempt to maybe to scare these people to stay in their homes. But is that the right approach, scaring them, or is it maybe experiencing or sharing experiences like other young people who have maybe gone through a harrowing experience with COVID-19? Could that be a more persuasive way?
Yeah, that sounds. I mean, it would be very nice to have research on it. I mean, it is unfortunately the case that most health communications are never tested. Somebody decides, oh, this would be a good message. Everybody will understand this, or this audience will understand it. They put out the message, and if the message doesn't work, it doesn't speak to people, it doesn't reach to them, it doesn't seem credible, then they're bewildered. The sources are bewildered that people haven't understood their message. So I would say, I think you had a very good hypothesis. It would be worth testing a message before issuing it. Another hypothesis, something that we find, is that people have mental models that they use to try to understand complicated situations. They're intuitive theories about how the world works. So over this period, people's intuitive theories of where their hands go and how hard it is to keep their hands from their face. That intuitive theory has improved. Their intuitive theory of how to wash their hands has probably improved. Mm-hmm. I don't think I think people still have a poor intuitive theory of how they're having a disease, being asymptomatic, can be transferred to somebody else, and then transferred to a vulnerable elderly person or immunocompromised person, and then they can hurt them. And I think if people understood for some people, understanding these cascaded effects on others might be enough to push them over the threshold.
Mm-hmm. For most of us here in Korea, we have kind of been ahead of the curve of the U.S. and many other sort of European countries in dealing with this outbreak. And we have seen people line up in very long lines for masks. But beyond that, very little panic buying. And I have to say, some people here in Korea are wondering, why is it that people in the U.S. and other parts in Europe as well are lining up and hoarding basic supplies, especially toilet paper. Could you maybe get us to understand the mentality behind that?
So I should say, as you may know, your country is getting a lot of praise in this country. People think about the Korean model and wonder why we can't do what you do in terms of testing and tracking and so on. And I think the story with toilet paper is a nice, I guess, a microcosm of how complicated social processes work. So in this country, we had very poor planning. We had authority figures who assured the public that this was not a problem, that it was going to go away. And all of a sudden, so people continued with their normal habits, which is, buying a certain amount of toilet paper, for example, a certain amount of food. All of a sudden, the message flipped, and people said every responsible individual should have food and toilet paper and everything else for 2 to 4 weeks. So you had responsible people who said, well, I better buy these things. You go to the store, if you don't find your favorite food, you can find some other food. But there is no substitute for toilet paper. The stores have just-in-time delivery, so they weren't prepared for the rush of buyers, so they couldn't meet the demand, and then the supply chains got disrupted,
right.
And so it was a case where you had individual rationale. People were put in an impossible situation where they acted individually in a reasonable way, and the whole system collapsed because it hadn't been prepared.
Mm-hmm. And of course, I guess what they see on media, whether it's mainstream media or social media, when they see people buying this, they also feel a need to do the same and go out and stock up as well, even though they have toilet tissue at home. But I guess the Korean example and many countries here in Asia, it's because we have also learned from SARS and MERS as well. So that experience, I think, has helped how not only our authorities prepare, but also how the public perceives and reacts to this threat as well. Do you see any positive outcome from this?
I'm sorry, I talked over you. My apologies.
My question was, sorry, Dr. Fischoff, my question was, do you see any positive outcome from this COVID-19 in terms of experience and lessons learned?
I think I was part of a planning effort during H5N1 or avian flu, which was 15 years ago, and in the U.S. we were largely spared by SARS. We were largely spared by avian flu. We've had a number of scares that I think taught us very little institutionally. We were, quite unprepared. Our federal government has cut back on its investment in pandemic surveillance and preparation. So we probably would have been better off had we had, now had we suffered the way that you have. The turmoil here is so great now. I think it'll be very difficult to anticipate what things will look like 6 or 9 months from now. Once, most of us will get through this and people will try to figure out what it means for the society. But I think right now it's too raw to predict what those lessons will be.
Mm-hmm. Dr. Fischer, are you at all concerned about the post-traumatic sort of effect of this on society, maybe not just the U.S., but for the global community as well, the social distancing, the self-quarantining, even after the outbreak has been contained? Do you see it sort of playing out for many months even to come, and this affecting human relationships?
Well, I'm a cognitive psychologist. I study decision making, so that's not my expertise. So this would be just my personal opinion. Mm-hmm. Is I see an awful lot of pro-social behavior of people trying to help one another, finding innovative ways to use electronic communication, finding ways to supply food to neighbors who have difficulty getting it. And I think those personal bonds will be important to people. People will suffer economically. Being shut in for long periods of time will wear them down. So we'll have a legacy of both fatigue and and good behaviors. Our local health department, when they announced the local stay-at-home order, phrased it as a test of our humanity.
Right. And on that positive...
That was a good way to think about it.
And on that positive note, I'd like to close the interview. And thank you very much once again, Professor Baruch Fischhoff, Professor of Public Policy Psychology and Strategy at Carnegie Mellon University. Thank you very much.
Thank you. Goodbye.
And in closing, I just want to read out a message from our longtime listener, El saying that everything Professor Baruch said also applies to her or his country from Morocco, no difference, and hoping that we stop being selfish and act as a big family. And that's going to bring us to the end of today's English edition of TBS EFM's COVID-19 live updates. Stay tuned for the live updates in Chinese. They are coming up next.